From a very tender age, one is taught to clean the teeth at least twice a day. This, according to dentists, strengthens the teeth and keeps it healthy. Thus, not taking good care of your teeth can lead to gum diseases, which are very common and could affect the patient without clear symptoms or pain. A big percentage of the population has gingivitis, which is inflammation of the gum issues, and it is reversible. This means that if the plaque is removed, the gum will go back to the original healthy status with no persistent damage. If the plaque is not removed, it turns into calculus, which is a hard layer that is attached to the surface of the tooth and is not easily cleaned with a normal toothbrush. The longer you leave the disease untreated, the more difficult it is to cure. So, regular visits to the dentist and simple oral hygiene instructions such as brushing and flossing can prevent gingivitis from turning into something more dangerous.
Okay, welcome back. Now, time for me to introduce my studio guest. His name is Dr. Albert Hammond. He's a dental surgeon at the Nabita Hospital in Temma. Good morning, Doc.
Good morning.
How are you?
I'm fine, by
good. And I also exposed him a little bit. He's also my dentist. So, welcome to the studio.
Thank you.
All right. Doc, we saw some of the pictures, and obviously one of the main things that, as a human being, can tell you're happy, can become a welcoming issue, all of it, is a smile. Now, when we have gum disease or we have issues with our mouth, obviously that's not going to be fully appreciated. First off, how do we stop ourselves from getting gum disease?
Well, gum disease essentially is an oral hygiene disease. I say that because when you look into the mouth, there are several and millions of bacteria in the mouth. And some of them are normal. In fact, most of them are normal in the steady state. But where the mouth is not cleaned properly, it creates an environment that makes it easy for these bacteria to proliferate.
Okay.
And then when they become established in the mouth, that's when gum disease sets off, just by inflammation of the gums, and then eventually progresses to when bone is damaged and then the teeth become loose. So it's essentially a hygiene problem. There are other factors that can make it go faster, such as age, smoking, alcohol, and other factors also. But it's essentially a hygiene problem.
All right. So, for instance, I mean, culturally, some people don't even use toothbrushes. We wake up, use chewing stick, and all the rest of it. Are those things affecting our gums as well, or have an effect on gum disease? Yeah,
the trend now is that even if you are using a toothbrush, or even if you are using whichever method, sponge, chewing stick, you use it with a toothpaste. But the thing with brushes, sponges, is that they cannot clean every aspect of the teeth. They can clean the broad parts that we can see. Mm-hmm. But where the disease gets established is in between the teeth and the gums. That's where the brush cannot fit in very well. So it's recommended that you do all these things twice a day. But at least twice a year, you have to visit a dentist for professional cleaning.
Yep.
If not a dentist, a hygienist or a therapist, for professional cleaning to be done. The film that is in between the teeth, if it's hardened to form calculus, is removed, and then you will be given some oral hygiene instructions, and then that should reduce the occurrence of the disease.
Okay. There are some people who still do everything that is told to them and still get gum disease. Are there certain people who are susceptible to it rather than others?
Yes, there are groups of people. One, there's if there's a family history of gum disease, especially the aggressive type of gum disease, what we call aggressive periodontitis, where in certain individuals the bacteria that causes the disease sort of causes early breakdown of tissue. So we are looking at the bone, we are looking at the fibers that hold the tooth to the bone. Yes, it's a familiar trait. Then we have people who have diabetes. Diabetes increases your chances of having gum disease. Yes, people who smoke also, there's a higher incidence of gum disease. Like those who take alcohol, those who have other conditions where the immune system has been suppressed, because what happens is that the body on any day should be able to take care of diseases that come into the mouth. But where you have underlying systemic condition such that you are not able to fight infections very well.
Right.
Yes,
so anything that will reduce your immune system,
yes,
or the strength of your immune system, could bring on gum disease also. Okay, so let's talk about because even the video said it's reversible.
Yes. It's reversible.
Is it always reversible?
Not always reversible.
Not always,
yes,
okay.
because if it's in the early phase, see, let me just throw a bit more light.
Sure.
Gum disease starts from inflammation of the gums, but gum disease is just a terminology that people use for periodontal disease.
Okay.
Yeah, when we are talking about the periodontium, we are talking about the gums. We are talking about the fibers that hold the tooth to the bone. We are talking about the cementum, what covers the roots. And then we are talking about the bone proper.
Mm-hmm.
So if the disease starts from the gum level and you're able to take care of it, it's reversible.
Okay.
Now, the part where it gets difficult to treat is when it's advanced, when there's loss of attachment, when bone has been destroyed, where the gums have receded. Because once the gums have receded, they do not grow back.
Regenerate.
Yes,
okay.
When bone has been lost, also, unless you take some surgical procedures to try and augment that bone, it's not going to come back.
All right.
Yes, so it depends on which phase. But if it's the early phase, most people will have it reversed. Yeah.
Okay, and how do we get there? How do we reverse the process?
Like I said, good oral hygiene practices.
Okay.
Brushing very well twice a day with a good toothbrush or whatever aid that you are using. And then you also make sure that you visit the dentist twice a year. The twice a year is very important because, you see, no matter how hard you clean, no matter how, even if you clean 20 times a day,
there will always be
the plaque would be there one way or the other. And when the plaque stays in the mouth for a very long time, it will mineralize and they will form the tartar or the calculus,
which is the dark
yellowish spots
on the back of
in between the teeth, sometimes at the back of the lower teeth.
Mm-hmm.
And these ones, people use all manner of funny things to try and get them to those things, of toothpicks, safety pins, all manner of things, and you rather cause more damage to the gums. So when you visit the dentist, these things are done twice a year, and the dentist will also assess whether there are other things going on which will make gum disease progress faster in your mouth. It's his duty to examine each and every tooth, all the 32, and then he will inform you whether there's something else that you need to do aside the regular brushing.
Okay.
There are also adjuncts like mouthwashes, there are medicated mouthwashes which also reduce the bacterial load in the mouth, the plaque-causing bacteria. There are some mouthwashes that are in the system we should be able to help.
Okay. Now, what are the things that we should be avoiding then? You mentioned smoking, you mentioned alcohol. I know about coffee, but we've got foods that are very rich in color, very rich in oils, some of which have high sugar contents. Are these factors that would also add to gum disease and gingivitis? Okay,
when it comes to sugar, the risk for sugary items lies with tooth decay, not more towards gum disease.
Okay.
Yes, but there are things that these things would cause tooth decay. But strictly speaking, when you are talking about gum disease, it's more of, like I said, a hygiene problem.
Okay.
It's more of a hygiene problem more than what you take in. The alcohol, the smoking, those ones increase the risk of it going up. Yes. Then the other things that we have to know is that gum disease has some effect on systemic health. For example, current research shows that there's a strong link between gum disease and maternal health.
Okay.
Yes, there's a risk between gum disease and low birth or preterm babies.
Okay.
There's a link between gum disease and diabetes itself. There's a link between gum disease and heart disease, cardiovascular disease. So you might want to take a more serious look. Yes, because it's not just the gums. Most people will come and say that, I don't have any pain, I'm okay. But one thing you have to understand, once the bacteria gets into the bloodstream, the dangerous bacteria, they can go anywhere.
Okay.
Yes, and you don't have any control over that.
All right. So for someone who's at home right now who may not be able to get to a dentist or an oral hygienist, what are some of the things that they can look out for to find if they're getting gum disease?
Okay.
For instance, will your gums be bleeding? Would they be sensitive?
Yes. The early phase of gum disease, in fact, is silent. You do not really know what's happening.
Okay.
Yes. When it starts establishing itself, the milder symptoms that you experience are bleeding gums, either on brushing or spontaneously. Then, of course, you could also have sensitivity. If the gums are receding, if the level is pulling, you see that your teeth are looking longer than normal. It's not that the teeth have grown long. It's because the gums have receded.
Okay.
So that's when you should be thinking of seeing the dentist. And then the end of the spectrum is that as bone is damaged, as the fibers that hold to the tooth are also damaged, then the teeth become loose. And the end, the end result of gum disease is tooth loss.
Right.
Now, it's going to cost you more to try and replace those teeth than you visiting the dentist
to save them.
Yes, to save them. Because once you take the teeth out, I mean, the dentist will charge you for taking the teeth out. He's going to charge you for putting the replacement.
Yeah.
Well, you could have saved that and just gone for a regular checkup and had a professional cleaning done.
Okay. Is bad breath anyway an indication of gum disease?
Yeah, bad breath can be a sign of gum disease, but not everyone who has bad breath has gum disease.
Okay.
Yes, because essentially most of the bad breath, about 90% of it is caused from the tongue, where people do not clean the back of the tongue as well as they're supposed to do.
Okay.
But in advanced gum disease, you definitely have some form of bad breath.
Okay. Let's go through, quickly, just the process of teeth brushing. How long it should take, how it should be done.
Okay. There are various techniques that people use. And as health professionals, we are told not to be too fussy, but we should make sure that the patient uses a method that is very convenient to him. So far as it doesn't wear off the gums. Because if you are doing horizontal brushing, a horizontal technique, with a very hard bristle brush, chances are that you are going to cause the gums to recede.
Okay.
So we do not advise people brushing with a very hard to brush. We advise a soft to medium brush. Now, traditionally, people are used to brushing the hard brush because if you are brushing in your house, it's assuming your next door neighbor should be able to hear you brush. Otherwise, your mother might spank you and say you are not brushing too well. So that's where the mistake starts from. And then brushing should take at least 2 minutes. Okay. You should spend at least 2 minutes brushing your teeth, and morning and evening. The evening one is even strongly recommended. I mean, that if you miss the morning brushing, at least you shouldn't miss the evening brushing. Yes, so a soft bristled nylon brush.
Okay, but I don't know about, well, some people might agree with me out there. If I use a soft bristle brush, I don't feel like my mouth is completely clean.
Yeah, that's true. A lot of people say that, but it's not the feeling. You see, if you brush in the correct technique, there's a method that you call you angulate the brush at 45 degrees, try and go in a circular pattern. Right. Yes, that one works well. I mean, you'll be able to clean almost every part of the tooth, except in between, where you have to use things like a dental floss or an interdental brush, depending on which scenario you find yourself. Okay. Yeah, these things are good enough, and then the dentist will add the professional cleaning.
When somebody has laceration or breakages on the tongue, what's that an indication of? Is that, or does that add to? Is there any indication of something that's happening in the mouth? On the tongue itself, not necessarily the teeth? I mean, because some people brush, they might clean their tongue, and there might actually be some blood or something.
Yeah, that if you brush too hard, like for example, if you are using a very hard brush, definitely the tongue would bleed. And then there are a few people who have a chronic condition. It doesn't really harm the patient, but you realize that always a layer of the tongue has sort of peeled off. Somebody like that will have to be very careful. Yeah, there are a few people who have that condition. You always see that today there's a sore here, next day it's moved to this aspect. It keeps jumping from position. That person has to be very, very careful when the person is brushing so that it doesn't traumatize the tongue. Yeah.
All right. Thank you very much, Dr. Hammond. At this point, we're going to go over to the other studio where I believe Bridget is standing by, because we should have some responses to the question on social media about gum disease this morning. No? Okay. All right, so Doc, just to round things up here, so what would be your advice to the general public when it comes to preventing gum disease?
Yeah, I would like the public to take care of their gums very, very seriously, because the end result, like I said, of untreated gum disease is tooth loss. I mean, you could have all the money in the world, but if you have loose teeth, you are not able to chew very well, you are not able to enjoy your food, your teeth keep falling out every now and then, your mouth is bleeding anytime you brush. It's a very uncomfortable thing, and you do not have to wait till it gets to that stage, because then the treatment becomes extensive. One of the things we are strongly advocates in the treatment of gum disease, number one, is patient motivation, because if it's advanced, it means you are going to come a lot of the time. It's not really about the money, but you should be motivated to come throughout the whole treatment. And it's one of the things that patients easily give up on. They come once, twice, they think that there's no improvement, then they go and relapse. So you should find a time. Once you are able to do that twice yearly, visits.
Checkups,
Yes,
yeah.
you should be fine.
Yeah.
Most people will be fine, unless there's something else going. Maybe you have a systemic condition that will make the gum disease a bit worse.
Okay.
Then the dentist should be able to tailor you the program. Maybe every 3 months, maybe
Come back
every
for a
month.
visit.
Yes, you come, and you should be fine.
Okay. I want to say thank you once again.